A great day to increase positivity and productivity. This is me again, your Dr. Miko. So for today's video, we will be learning a lot about facilitation and inhibition technique. But before going to different techniques used in facilitation and inhibition, let us first discuss the differences and usage of these techniques. When we say facilitation techniques, it is used to those patients who have hypotonia or muscle weakness. On the other hand, inhibition techniques is used for those patients who have spastics. There's a difference between inhibition and facilitation techniques. Now, what are we waiting for? Let us now focus on the different techniques used in facilitation and inhibition. Enjoy watching! One of the facilitation technique is light moving. Light moving is mediated by a delta sensory fibers. It activates low dorsal hair organ and free nerve endings. It is applied with a fingertip, 3 to 5 strokes, and allow 30 seconds rest between strokes to prevent overstimulation. More formally, it activates superficial mobilizing muscles and increases corticosteroids levels in the bloodstream. Next technique is A-icing. A-icing is mediated by A fibers. The procedure of these facilitatory techniques is an ice applied in the skin in 3 quick swipes and water blotted with a towel between wipes. It facilitates muscle activity and ANS responses. More so, it increases breathing patterns, voice production, and general vitality. Let us proceed to the vestibular stimulation. It is a powerful type of proprioceptive unit. It activates the anti-gravity muscles and their antagonist muscle before the stretch reflex of the muscle spindles. The system affects tone, balance, direction, protective response, cranial nerve function, bilateral integration, auditory language development, and eye perceits. It is stimulated through linear acceleration and deceleration in horizontal and vertical planes, and angular acceleration and deceleration such as spinning, rolling, or swinging. One of the inhibition techniques is the slow rolling. Slow rolling, PT is rolled slowly from a SL position to prone and back in a rhythmical pattern. It means it uses on both sides of the body. When we say maintain stretch, it is positioned in the elongated position to cause lengthening of the muscle spindle, to reset the afference of the muscle spindle to a longer position so they become less sensitive to stretch. That is maintained stretch. Another inhibition technique is rocking. Rocking, in this technique, the patient is positioned in a weight-bearing position and the weight is shifted in different direction like forward and backward sideways. That is rocking.